Is it better to get surgery or is it better to do your radiation therapy? What do you think?
See, it all comes down to patient preference and the condition of the patient. Suppose if the patient prefers to get surgery, then we give the patient the option of surgery. And if he doesn't want to undergo surgery, then radiotherapy is also an option. And even the condition, suppose if it's a disease of the old age, basically.
Okay.
So if patient is unable to undergo a morbid procedure and all, then we would always recommend radiotherapy as a good option.
Now, this is in patients, say, around 65. What if your patient is, say, 85, and the, the number of years that the patient has to live are, say, fewer in number?
Yeah.
So do you still go for something like surgery? Do you still go for radiation therapy? Or do you just prefer to, watch and wait kind of method?
Yeah, so prostate cancer is a slow growing disease. So watch and wait in patients who don't have much of a life expectancy is always a good option. And it's also a good option because at that age he may not be able to tolerate such kinds of treatment.
Okay. Whether
Because
invasive or otherwise.
yeah, yeah.